Hello everyone. Today, BEBETO, ELTHER and I from class 4 DELIMA are going to present about the health issue related to the human endocrine system. So, after learning about the human endocrine system, there are a few health issues that you have to know about. So the first one is the hypothyroidism. So what is a hypothyroidism? It is a disease that occurs if there is inadequate thyroxine secretion from our body. The causes of this disease are the autoimmune disease, known as the Hashimoto's thyroiditis. Autoimmune disorder occurs when your immune system produces antibodies that attacks your own tissues. Next, radiation therapy such as X-ray also could lead to hypothyroidism. Radiation used to treat cancers of head and neck can affect your thyroid gland and may lead to hypothyroidism. So, these are the symptoms of hypothyroidism. First, thinning hair and hair loss, loss of eyebrow hair, puffy face, enlarged thyroid, dry and coarse skin, slow heartbeat, constipation, poor appetite, infertility or heavy menstruation, cool extremities and swelling of the limbs, and carpal tunnel syndrome. Other than that, we also have weight gain, poor memory, intolerance to cold, and feeling of tiredness which happens inside of us. Now let's proceed to the next disease. The next disease is the hyperthyroidism. It is the vice versa of hypothyroidism. So what is it? It is a situation that occurs when too much thyroxine is secreted from our body. The causes of this disease are the Graves' disease. The Graves' disease is an autoimmune disorder in which antibodies produced by your immune system stimulate your thyroid to produce too much thyroxine. Next, we also have the thyroiditis. Sometimes, when your thyroid gland can become inflamed after pregnancy due to an autoimmune condition or for unknown reasons. The inflammation can cause excess thyroid hormone stored in the gland to leak into your bloodstream. So as for the symptoms, since for the hypothyroidism, we have the weight gain, and then we have constipation and poor appetite. However, it is the other way for the hyperthyroidism. For hyperthyroidism, we have nausea, vomiting and diarrhea, increased appetite, and excessive weight loss. And then we also have fine brittle hair and hair loss, bulging eyes, increased perspiration, enlarged thyroid, enlarged liver, abdominal heart rhythms, hand tremors, loss of libido, amenorrhea, irritability, hyperactivity, high blood sugar, intolerance to heat, and also low serum cholesterol. Oh, and for the enlarged thyroid, sometimes the thyroid gland will grow up to 2 or 3 times larger than its original size. Most of the time, this hyperthyroidism and hypothyroidism disease are not life-threatening. However, if these symptoms show up on your body, we advise you to refer to a professional medical personnel for a proper diagnosis.
So I am ELTHER, and today I am going to talk about diabetes mellitus and diabetes insipidus. First, what is diabetes mellitus? Diabetes mellitus, commonly known as diabetes, is a metabolic disease that causes high blood sugar. The hormone insulin moves sugar from the blood into your cells to be stored or used for energy. With diabetes, your body either doesn't make enough insulin or cannot effectively use the insulin it does make. And diabetes mellitus is divided into a few different types. First, type 1 diabetes. What is type 1 diabetes? Type 1 diabetes is an autoimmune disease, which means the immune system attacks and destroys cells in the pancreas, where insulin is made. It is unclear what causes this attack, and about 10% of people with diabetes have this type. So these are the symptoms of type 1 diabetes. They are extreme in hunger, increase of thirst, unintentional weight loss, frequent urination, blurry vision, and lastly tiredness. What causes type 1 diabetes? We don't know exactly what causes type 1 diabetes. For some reason, the immune system mistakenly attacks and destroys insulin producing beta cells in the pancreas. Genetics and viruses are also one of the reasons for it. So what is the treatment for type 1 diabetes? Insulin is the main treatment for type 1 diabetes. It replaces the hormone your body isn't able to produce. There are 4 types of insulin that are most commonly used, and they are differentiated by how quickly they start to work and how long their effects last for. First, rapid-acting insulin that starts to work within 15 minutes and its effects lasts for 3 to 4 hours. Secondly, short-acting insulin that starts to work within 30 minutes and lasts 6 to 8 hours. Thirdly, intermediate-acting insulin starts to work within 1 to 2 hours and lasts 12 to 18 hours. And lastly, long-acting insulins that starts to work a few hours after injection and lasts 24 hours or longer. Next, type 2 diabetes. What is type 2 diabetes? As for type 2 diabetes, it occurs when your body becomes resistant to insulin and sugar builds up in your blood. These are the symptoms of type 2 diabetes. They are increased in hunger, increased of thirst, and thirdly, urination will increase, blurry vision, tiredness, and lastly, sores that are slow to heal. What causes type 2 diabetes? What causes type 2 diabetes? So type 2 diabetes is caused from a combination of genetics and lifestyle factors. Being overweight or obese increases your risk too. And carrying extra weight, especially in our belly, makes our cells more resistant to the effects of insulin in our blood sugar. As for treatment for type 2 diabetes, first, we can lose our weight. Secondly, healthy eating. Next, regularly doing exercises, possibly diabetes medication or insulin therapy, and lastly, blood sugar monitoring. Okay, so now for diabetes insipidus. What is diabetes insipidus? Diabetes insipidus is an uncommon disorder that causes an imbalance of fluids in the body. This imbalance makes you very thirsty, even if you had something to drink, and it also leads you to produce large amounts of urine. And diabetes insipidus is also divided into few different types. First, cranial diabetes insipidus. Okay, what is cranial diabetes insipidus? It is where the body does not produce enough antidiuretic hormone ADH, so excessive amounts of water are lost in large amounts of urine. For your information, ADH helps to control blood pressure by acting on the kidneys and in the blood vessels. So what causes cranial diabetes insipidus? First, a brain tumor that damages the hypothalamus and or pituitary gland. Secondly, a severe head injury that damages the hypothalamus or pituitary gland, and lastly, complications that occur during brain or pituitary surgery. So this is the treatment for cranial diabetes insipidus. Cranial diabetes insipidus can be treated with a manufactured version of antidiuretic hormone called desmopressin in the form of a nasal spray or tablet. The dose given and how often medication needs to be taken will depend on the severity of diabetes insipidus and the symptoms the patient has. So next, nephrogenic diabetes insipidus. What is nephrogenic diabetes insipidus? It is where AVP, that stands for arginine vasopressin, is produced at the right levels, but for a variety of reasons the kidneys fail and do not respond to it in the normal way. As for your information, AVP also known as ADH, which is antidiuretic hormone. So what causes nephrogenic diabetes insipidus? The nephrons in the kidneys are not able to respond to the signal, leading to excessive water loss and large amounts of urine. Your thirst increases to try to balance this loss from the body. Nephrogenic diabetes insipidus can be present at birth or develop later in life as a result of an external factor. So this is a way of treatment for nephrogenic diabetes insipidus. So for the treatment for this disease is a water tablet diuretic called hydrochlorothiazide or amiloride, but the desmopressin for this disease will not. Somehow diuretic in some people with nephrogenic diabetes insipidus, it can reduce urine output. Okay, so that's all from me.
Okay, so today I'm going to present gigantism. Gigantism is an excessive secretion of the growth hormone during childhood causes gigantism, which is a condition characterized by the abnormal elongation of bones. The individual grows to become extremely tall. So firstly, if the child is suspected to be an gigantism person, it will first diagnosed by a doctor, and the blood test will be taken to check and measure the level of growth hormone of the child. Secondly, the symptom is very large hands and feet, thick paws and finger, sleeping disorder, weakness, excessive sweating, deafness, and severe or recurrent headache. And the treatment is medication, surgery, gamma knife radiosurgery, and also long-term outlook for children with gigantism. So as we can see here in the example, we can see a person who is a tall person. That's the person who has the gigantism. Okay, secondly, I'm going to present about dwarfism. Dwarfism is short stature that results from genetic or medical condition. Dwarfism is generally defined as an adult height of 4 feet 10 inches or 147 centimeters or less. The average adult height among people with dwarfism is 4 feet, which is 122 centimeters. There are so many types of dwarfism. This is the dwarfisms that I can list. First is achondroplasia, which is 70% of the dwarfism cases is an achondroplasia. Secondly is spondyloepiphyseal dysplasias, which is 1 in every 95,000 babies had it. And lastly is diastrophic dysplasia. Okay, so first the symptom is the person or the baby has a very short trunk, a broad chest, a twisted feet, short fingers, and a prominent forehead. So the treatment is surgical treatments, hormone therapy, ongoing healthcare, and limb lengthening. So as we can see here in the picture below, the example of dwarfism is this person who had a dwarfism. As you can see, the person still looks like a child. I think that's all from me. Thank you.
That's all from us. We hope that you guys find these informations are beneficial for your biology studies. Thank you and see you again next time. Goodbye.